In that brownie pinky discharge, it's going to be blood mixed with like cervical mucus, or you could just see straight up like red spotting or like brown. So this is going to be like older blood. If it's like the brownie color, if it's pink, it could be like light bleeding. There's different times in your cycle where this could be considered normal and when it could be considered abnormal. So times that it would be normal would be like if you're getting a little bit of that discharge or like bleeding right before your period. So it's like a day of spotting, or like at the tail end of your period. If you are in your teen years, you might see this a bit more because our cycles can be a little bit erratic, but that should regulate over time. If you are pregnant, you could get that implantation bleeding like approximately 6 to 12 days after ovulation. That can be considered normal. You might be the type of person to get ovulation spotting, which lasts like about like a day or two, and it's generally just like a little amount. It could be like some blood mixed with the mucus. That could be what you're seeing with the brown and the pinky like discharge. It shouldn't be painful and you shouldn't be like bleeding a lot. So if you are like getting those type of things, then I would get that checked out. If you are on birth control, that can throw off your hormones as well, and then you could see some of that discharge or spotting too. Times this would be considered abnormal would be like if you're getting a lot of days of spotting or like that discharge before your period comes, or if you're getting a lot of days at like the tail end of your period where like the spotting just keeps continuing and continuing. I could suggest either low progesterone or a short luteal phase. If you're getting spotting throughout like your whole entire cycle, or like you finish your period, you have a week and then you start spotting again and it stops, and then you spot again and then it stops, then I would question, are you ovulating? Is there PCOS, endometriosis, certain infections? Is there a polyp or a fibroid? Are we dealing with a thyroid issue? Different things like that can all contribute to like lengthy spotting or like seeing that discharge. And those are all things that I would get checked out. If you're only seeing this for like one cycle and the rest of your cycles are regular, that's usually no cause for concern, and as our cycles can change due to stress. But if you're seeing this like cycle after cycle, that is something I would get checked out.